So our last speaker is Professor Hayat Mukhtar, who is the head of an Ayurveda college and was added to the program. We invite you to please come.
Respected Chair, Co-Chair, distinguished guests, delegates, ladies and gentlemen, a very good evening. I want to make a correction. I'm not head of Ayurvedic college. I'm a head of pharmacy college. I'm from Punjab. A number of research papers presented or case studies were related to the human beings. I think something was missing, that is animals, and I'm here to present last paper of this Congress that is dealing with animal study. The topic is the evaluation of the hypoglycemic activity of one of the medicinal plants, that is Tinospora Cordifolia. I will leave the introduction, herbal medicine, the definitions I'm again leaving. This is a European definition. Why is a great interest in alternative medicine? There's a belief that herbal medicine might be effective, benefit in the treatment of certain diseases where conventional therapies, medicines have proven to be inadequate. Concern regarding undesirable side effects of modern medicines and the belief that herbal drugs are free from side effects. And the preference of populations for preventive medicine due to increasing population ages, tendency towards self-medication, improvement in quality, proof of efficacy, and safety of herbal medicines, and the high cost of synthetic medicines. Now, some problems associated with the use of herbal medicines is the lack of quality control and standardization, adulteration with other plants, pharmaceutical drugs or heavy metals, inappropriate use or misleading claims, potential for drug interactions, lack of knowledge of interactions, adverse drug reactions, etc. Diabetes mellitus is a chronic disease characterized by high blood glucose levels due to absolute or relative deficiency of circulating insulin levels. And it is the primary cause of chronic kidney failure, blindness, high blood pressure, and coronary artery disease. Diabetes mellitus was known to ancient Indian patients as Madhumeha. Ayurvedic and Unani systems are ancient Indian form of medicine, which deals with the plants and plant extracts. Many herbal products, including several metals and minerals, have been described for the cure of diabetes mellitus in ancient system. Plant drugs are frequently considered to be less toxic and free from side effects than the synthetic ones. I will also leave this introduction. Now coming to the plant, Tinospora cordifolia. It consists of a dried, we have used dried stems of the plant. Family is Menispermaceae, I will leave this the details. And the common name in Hindi, it is known Amrita, Giloy, Gulbel, Gurchi. And English names are the Sanskrit, Punjabi, I am again leaving. Organoleptic characters is a dried, surface is watery, it is odorless, bitter, fracture is fibrous. Chemical constituents. Now coming to material methods. Collection of the plant. In this study, stems of the Tinospora cordifolia were collected from Punjab, and the plant was identified and authenticated by botanists from GND University, Amritsar. Preparation of the extract, shade dry stems of the plant, 500 grams were used. They were extracted with the water and filtered. The filter was dried by vacuum evaporator, which yielded in a solid residue of 155 grams, that is 31% yield. Now coming to the experimental animals, adult rates of either sex were used. They were, weight was 100-150 milligram. And all the study was approved by National Animal Ethics Committee. I'm again leaving. Coming to pharmacological activity, we studied effect of this extract, two extracts at the dose level of 250 grams per kg body weight and 500 grams per kg body weight. First test was done on test drug on oral glucose tolerance test, that is OGTT. Details are there. The second test was done using the diabetic animals. The diabetes was induced by alloxone. Details here I'm again leaving. During the acute treatment, blood samples were collected from the tip of the tail just prior to and 1 and 3 hours after standard drug or extract administration. And during subacute treatment, it was continued for 14 days, and the blood samples were collected on the day 0, 7th, and 14th day. This is a table 1 showing the result of OGTT, that is oral glucose tolerance test. You can show from the table, normal glucose level was 140, and using the standard drug, it came to 78 grams per deciliter. And with our extract at the dose of 250 milligrams, it was 135. And when we increased dose to 500 grams, it was 110 grams per deciliter. There's a graphical representation. During the acute treatment of this plant with diabetic rats, you can see the normal control again at 73, with diabetic control 170, and with the standard drug, that is glimepiride, which we use at 151, and with the stem extract 164 and 151. Graphical representation. During the subacute treatment, again with diabetic control, it was 230. With the standard drug, it came down to 73. And with our stem extract, it came to 88 grams per deciliter. There was a reduction of 40%. And with the standard drug, 57%. And it was more positive result with extract when we used at 500 kilogram per kg body weight. Graphical representation. The results during the acute study of the aqueous extract of this plant at different treatments, this showed statistically significant reduction in the blood glucose level with p-value less than 0.001 at 3 hours after Alexon administration. During subacute treatment study, the oral administration of the aqueous extract of this lily plant at a dose of 250 milligram per kg body weight and 500 milligram per kg body weight reduces significantly with a p-value less than 0.001 the blood glucose level on 14th day after administration of the extract, this Alexon. Conclusion. The results indicate that aqueous extract of this stem heads of this plant, Tinospora Cordifolia, possess significant hypoglycemic activity during both the acute and subacute treatments. However, the extract of the stem of this plant at a dose level of 500 milligram per kg body weight showed better efficacy than that at a dose level of 250 milligram. Now the discussion. As you know, Alexon produces oxygen radicals in the body, which causes pancreatic injury and could be responsible for increased blood sugar seen in the animals initially. It is generally accepted that Alexon treatment causes permanent destruction of the beta cells. It is therefore conceivable that the hypoglycemic principles in the aqueous extract of the stem of Tinospora cordifolia may exert their effect by an extra pancreatic mechanism in diabetic rats. However, the exact mechanism is not known and further studies are needed for that. I thank you. I thank organizers of this conference and all Ayurveda family for making me a part of this wonderful conference. I also thank Shri Gireji for making adjustment. I know due to time constraint. Thank you, sir.
There's an old saying that animals are people too. So on this note of health on all levels and scientific validation of Ayurveda, we appreciate that talk. This brings to a conclusion this session, and I think we'll go from here to the felicitations event. So, Jai Gurudev.